Hi everyone, I am Mrs. Diarrheal, Assistant Professor, Community Health Nursing Department. Today I am going to discuss about Rmnch+A program. The objectives of this session are, at the end of the teaching, the students will be able to state the meaning of Rmnch+A, explain the aim of Rmnch+A, discuss the goal of Rmnch+A program, list down the approaches of Rmnch+A program, enlist the indicators of Rmnch+A program, explain the interventions of Rmncha program. This program was launched in India February 2013 by Ministry of Health and Family Welfare Department, followed the concept of Call to Action Summit. Let's see what is Rmncha. It is reproductive, maternal, newborn, child health and adolescent health. What is the meaning of plus A? That is including adolescent's health along with the maternal and child health. This linking of maternal health to the reproductive health, family planning, adolescent health, HIV, gender, preconception and prenatal diagnostic techniques. Linking home care and community-based services, ensuring linkages, referrals and the counter referrals. The main purpose of this program is to reducing the maternal and child morbidity and mortality. That means reducing the diseases and the death rate among the mother and child. There are 5 pillars in Rmnch+A program. Let's see what are the pillars. First one is reproduction, second one is maternal, third newborn or neonatal, and fourth pillar is child or children, and the fifth pillar is adolescent. The main aim of this program is to reach the maximum number of people in the remotest corners of the country through continuum of services, constant innovations, routine monitoring. Remotest corner example, it's a hilly areas. In the urban or the normal rural areas, we can continue the services, we can implement the innovations in all these areas, but in hilly areas it is not possible. But through this Rmncha program, we should make it possible. That is the main aim of this program. Let's see the goal of Rmncha program. This goal based on the 12th 5-year plan objectives. The first one is reduction of infant mortality rate to 25 per 1000 live births. And the second goal is reduction in maternal mortality ratio to 100 per 1 lakh live births. And the third goal is reduction in total fertility rate to 2.1. Targets for Rmncha programs are increase the facilities for perinatal care by 100%. That means 24/7 services, need to have a good infrastructure, staffing and the equipment. Next target is increase the institutional delivery at 5.6% per year from the current status of 61%. And the next is increase the proportion of antenatal care at 6% per year from 53% of current status. Increase the proportion of postnatal care at 7.5% per annum from 45% of current status. Increase the proportion of deliveries conducted by the skilled birth attendant 2% per year from 76% of current status. Increase the exclusive breastfeeding rate at 9.6% per annum from 36% of the current status. Reduce the prevalence of underweight among under 5 children at the rate of 5.5% per annum from the current status of 45%. Increase the use of oral rehydration solutions in under 5 children with the condition of diarrhea at a 7.2% per annum from the current status of 43%. Reduce the unmet need for family planning methods among the eligible couples at the rate of 8.8% per annum from the current status of 21%. Increase the utility of modern family planning methods, example Chaya, Andara, no scalpel vasectomy and the laparoscopy tubectomy among the eligible couples at 4.5% per annum from the current status of 47%. Reduce the anemia among the adolescent girls and boys, the age group of 15 to 19 years at 6% from the current status of 56% among girls and 30% among boys. Decrease the proportion of total fertility among the adolescent group aged between 15 to 19 years at 3.8% per annum from the current status of 16%. Raise child sex ratio in the age group of 0 to 6 years at 0.6% per annum from the current status of 914 girls per 1000 boys. This according to the census 2011. Let's see the indicators of Rmnca program. There are 5 indicators are there. They are maternal mortality ratio, neonatal mortality rate, infant mortality rate, under 5 mortality rate and the total fertility rate. The current status of maternal mortality ratio in India is 122 per 1 lakh live births. National Health Policy target is 100 by 2020 and the Sustainable Development Goal 2030 target is should be below 70. Neonatal mortality rate current status in India it is 23. National Health Policy target is 16 by 2025. The SDG 2030 target is below 12. Infant mortality rate current status is 33, but we need to reduce it by 28 by 2019. It is according to the National Health Policy target. Under 5 mortality rate, the current status is 37. We need to reduce 23 by 2025. The total fertility rate is the current status is 2.2. According to the National Health Policy target is replacement level fertility. So what is the meaning of replacement level fertility? Is the level of fertility at which a population exactly replaces itself from one generation to the next. We need to follow some strategies or approaches to achieve the goal of Rmnca program. The first one is health system strengthening. That means we need to have a good infrastructure, adequate staffing and the equipment to provide care to the people. And the second approach is need to have a prioritization. That means according to the need, we need to provide the services to the people. And third approach is increasing effectiveness of investments. So whatever the resources or we are utilizing or we are using it for the community, it should be effectively reached to the people. And the next thing is integrated monitoring and accountability by using the available data. The fifth one is collaboration and partnerships with all the departments, not only the health department. We need to have a partnership with the education, agriculture, transport and the social department. The interventions of Rmnca programs are reproductive health, maternal health, newborn health, child health and the adolescent health. These are the main pillars of Rmnca program. The interventions also need to be done under this pillars only. The first thing is reproductive health. Here the spacing methods need to be provided after the delivery. This PPIUCD postpartum intrauterine contraceptive device need to be maintained the interval between 2 childbirth, minimum 3 years and maximum 10 years. And the third thing is home delivery of contraceptive devices and the ensuring spacing at birth by ANM or the ASHA. And the fourth one is PTK, that is free of services by Government of India and the state government. It is called Rmnca kit. PTK means that is pregnancy test kit to identify the pregnant mothers. And the fifth thing is sterilization. It is separately available for male and the female. Male it is called vasectomy. Female it is called tubectomy. So everything is free of cost service. Then second pillar is maternal health. Here during the antenatal period, the mother need to register her birth in the PHC or sub-center or in the maternity center. By here we need to maintain the MCTS. That is, MCTS means Maternal Child Tracking System. If you are not having this PICME number, we are not able to register the birth of the child. And the second thing is screening of high-risk pregnancy, especially severe anemia, eclampsia, pregnancy-induced hypertension and gestational diabetes. And need to give adequate training to the people, those who are involved in maternal health. That is the staffs and the doctors. And the fourth one is review maternal and infant death. Anywhere the maternal and the infant death has happened, need to identify the root cause of that death. And fifth one is identify the low institutional delivery areas. And incentives need to be provided to the ANM for their domiciliary care services. Third pillar is newborn health. Here need to concentrate on the importance of exclusive breastfeeding up to 6 months of the infant life. Then HPNC through ASHA. HPNC means home-based newborn care, not to be given through a ASHA or village health nurse. And third thing is essential newborn care provided to the needy newborns. And fourth one is providing special newborn care at the hospitals, that is PHCs or maternal center or in the hospitals. Fifth one is use of gentamicin by ANM. Then standing order, the gentamicin need to be added. That means in case of absence of doctors, the ANM can be treat the bacterial infections of newborn. And the fourth pillar is child health. Here need to be focused on the nutrition, mainly under 5 children. Need to do the anthropometric measurements and find out the malnutrition and to treat it. And the second thing is diarrheal management. We can treat the diarrhea by using the ORS solution. And third thing is management of pneumonia. In Rmnca, it is insists about how to identify pneumonia and when to refer the child to the hospitals. That need to be managed at home and the center itself. And the fourth one is full immunization coverage. At least up to 1 year, the child must be immunized with all the vaccines available in the PHC. And this fifth one is RBSK. So what is RBSK? Rashtriya Bal Swasthya Karyakram is an important initiative aiming at early identification and early interventions for children from birth to 18 years to cover defect at birth, deficiencies, diseases, development delays, including disability. So mainly it will be implemented through the school health programs. And this next pillar is adolescent health. So teenage pregnancy. Nowadays the prevalence of teenage pregnancies are more. So to find out the prevalence and to create awareness among the sexual health to the adolescent people. And second thing is peer educators. Third thing is strengthen ARSH clinics, that is adolescents reproductive and sexual health clinics need to be strengthened. Mainly here they will give counseling and that is doing the safe abortion services. Iron Plus initiatives, that is weekly they are providing iron supplement to the adolescent girls in these schools itself. Mainly the government schools, every Thursday the child is receiving this iron and folic acid. And the fourth one is promote menstrual hygiene. Okay, these are the way we can able to achieve the goal of Rmnca. So here this slide's explaining about the continuum of care from according to the life cycle and the level of care. Life cycle starts from the adolescent till the child birth. Level of care starts from home to the clinical or hospital. So first life cycle is adolescent. So here the adolescent care starts from the family and community. The first intervention is WIPS program, that is weekly supply of iron and folic supplementation to the needy adolescents. Then the IEC on sexual reproductive health and the family planning, that is health education, community-based promotion and delivery of contraceptives, and the menstrual hygiene. For menstrual hygiene, there's free providing of sanitary napkin to the adolescent girls. And the outreach and subcenter level, the reproductive health cares are family planning, STA prevention, periconception, and folic acid supplementation to the adolescent. In reproductive care, comprehensive abortion care, RTA and STA case management, PPI-UCD and sterilization, that is PPI-UCD, that is postpartum intrauterine contraceptive devices, that is after delivery, adolescent-friendly health services. These are the reproductive care can be available in the clinical area, that is maternity center, hospitals, or the community health center. And the second stage is pregnancy and birth. Now here at the family and community, we can provide counseling to the untitled mother, especially preparation for breastfeeding, newborn care, birth preparedness also, and demand generation, that is JSY, Janani Suraksha Yojana, and JSK, Janani Sishu Suraksha Karyakram. This is entitles all pregnant women deliveries in public health institutions to absolutely free and no expense for delivery, including cesarean section also. Okay, that need to be that information need to be given to the antenatal mother. And the at the outreach level, that is subcenter level, here we can provide the full ANC package and postpartum contraceptive methods also can be given, and the pregnancy and childbirth care, skill obstetric care can be given to the that is the mother, and EMOC, that is emergency obstetrical care, can be provided. Immediate newborn care and resuscitations can be given, that facilities available in the clinical areas, and the postpartum intrauterine contraceptive devices, then the counseling, postpartum sterilizations also it is available. And the postnatal care, here the early detection and management of illness, immunization for the children. And the childhood, here the community level, HNBC, that is home-based newborn care, and infant young child feeding, child health screening, early childhood development, danger sign recognition and care seeking can be done at the family level. And the outreach level, the child health care need to be assessed and care of newborn care, immunization and micronutrient supplementation can be done at the subcenter. And in the clinical areas, essential newborn care, care of sick newborn, Rmnca can need to be followed, and the immunization also can be given to the child according to the immunization schedule. Let me summarize this session. Till now we have discussed about the meaning of Rmnca program, aim, goals and approaches of Rmnca program, indicators and the interventions to achieve the goal of Rmnca program. I conclude my topic, that is Rmnca is the key intervention for reducing maternal and child morbidity and mortality. This maternal health starts from the adolescent period itself. It will be promote the healthy generations. When we are concentrating on the adolescent girls, definitely we can get the healthy mothers in the future. Thank you very much for your patient listening.